Hello everyone, my name is Mike Milliard. I'm executive editor of Healthcare IT News, and I'm here at HIMSS 21 in Las Vegas with Laura Kreofsky, who's Vice President of Pivot Point Consulting. Laura, welcome.
Thanks, Mike. I'm looking forward to it.
Thanks for being here. So, we have seen one of the biggest public health crises of history, I suppose, this past year and a half. It's been a challenge, but one side product of it is there's been a lot of money sloshing around, a lot of public health funding. What do you make of that, and what can we do to maximize its potential?
The last year and a half has been something I'd never thought I'd see in my lifetime. And we have seen so much be allocated in terms of investment in funding for the CDC and for HHS and for a host of other public health entities through the Cures Act and through the American Rescue Plan, upwards of $100 billion in different channels and different funnels. And I think it's an unprecedented opportunity. Our public health infrastructure is failing, right? And I've been in this field for a long time, and we have not seen really any significant investment or advancement of technology for the public health sector, for CDC, for states, for reporting. There was a sliver of growth around the era of meaningful use. We started doing more registry and more immunization reporting, but other than that, we've been really limited. So with this bolus of funding, and it's come from, like I said, many sources and in many flavors, particularly a lot around COVID, testing and reporting. We're also seeing it in terms of rural health, telehealth and broadband. We're seeing it in terms of workforce development. So now we have this wave of funding opportunity. I think the big question is how do we capitalize on it, right? How do we step back from an environment which has historically been siloed, which has historically been, we'll build this, ourselves. How do we step back from an insular perspective and to build one that's really integrated and interoperable? So for me, when I think about that, because it's a big challenge, I think there's two or three things we need to do is from a private sector and from a health IT marketplace, we need to really liaison and partner better with public health entities. And I think we're seeing that at the state level, and I think we're seeing that also with large IDNs coming out and really working with their public health partners. But it's going to take that type of innovation and collaboration between private entities and public health, state, local, and even federal levels to really capitalize on what we have. I think the second thing that we as an industry need to focus on really is for public health agencies to move beyond thinking that they have to build all of this themselves, to start looking at commercial off-the-shelf products. So there's tons of opportunity in those two pieces alone. And then I think the third nugget here is really how do we step back and have enough of a strategy, enough of a plan and a roadmap to move forward without getting quagmired in planning. Because this is one of those situations where we really need to build sort of that veritable airplane while it's moving. Right. So we got a lot going on in the private sector, and then it's compounded on the public sector because COVID hasn't ended, and it's it's a long road ahead of us.
For sure. What else have you seen in the space? I can't help but notice there's been a lot of mergers and acquisitions going on. I mean, it's been for a while, but it seems to be even increasing in fever pitch.
Yeah, there's definitely a velocity here, and I think the last the onset of COVID, that first 6 or 8 months, there were some pauses, right? There were some big mergers and acquisitions that were canceled or postponed. I think part of it was just being overwhelmed with dealing with the health needs of society and of their communities. I think there was a capital concern, and also I think organizations stepped back to ask, "This is really a good fit. Is this really a good time?" But now what we're seeing is an uptick in that, and we're seeing it because some of the pressure is off, although we're seeing sort of the pressure come back on. But I think some of those organizations that were on the cusp of being individually viable are now even struggling more because of the hit they have taken. So in terms of mergers and acquisitions, we're definitely seeing an upswing in that. And from an IT perspective, I think organizations are getting more thoughtful about really integrating where they need to, about using data and data interoperability as a lever from when they don't have to fully integrate systems. And the third piece, what I'm seeing that's unique in M&A work and what we're starting to see a lot of is, how do I maximize the value of this? How do I do this application rationalization work so that we minimize our legacy expenditures? How do I make sure I'm making the right investments in data integration or data interoperability for the future? And it's not always a historical sort of the replacement mindset. So lots of change and lots of growth here.
Yeah, sort of along those lines, we're also seeing much more of an integration between the payer and the provider side. Kaiser obviously was a pioneer in that. We're seeing a lot more across the country of organizations taking on this sort of model. What do you make of that?
Yeah, we certainly are. And 30 years ago, I started at Kaiser, and it was kind of an anomaly, right? That you got a payer talking to a provider organization. I would say in the last few years that uptick has happened, one, because of the nature of the financial structures within healthcare in terms of value-based care, accountable care, and shared risk. And I'm seeing a need for better data interoperability and data exchange, and the Cures Act rules around patient data access, around portability, around interoperability have been an absolute game changer.
For sure.
Yeah, I was at an industry event about a year and a half ago, I guess it's 2 years now, and I was at a breakfast forum with a host of maybe 6 to 10 CIOs from healthcare organizations and their counterparts on the payer side. It's like 6 o'clock, 7 o'clock on a Monday morning. This room was packed, and those executives were sitting there saying, how are we going to do this? We got to figure this out together. They were looking at the Cures Act rules, and kind of their heads were spinning a little bit. For me, that was really the first time I'd seen sort of those two factions come together, and it's been a sea change since then.
Yeah, there's been a lot of changes since then.
Yeah.
It's been a busy year for your clients in the provider side space. What have you been seeing, and what are some lessons you think that they will be taking away to kind of build for the future?
I'm seeing clients that are both very weary and simultaneously really invigorated, if that makes sense.
It does.
They're working hard on, from a health IT support capacity with an organization. They're working really, really hard to take care of their caregivers. I think that's vitally important. I also see we did so much so fast in so many areas. Think about digital strategy and telehealth. I've seen a lot of organizations work now to mature those capabilities, sustain them. But I'm also seeing organizations step back and say, we did so much so fast. Let's do more of that.
Yeah, keep the momentum.
Yeah. So I think it's going to be a really exciting show in there because, I think the last year and a half we all embraced some technologies in a way that we may have not done 3-4 years ago out of necessity. So I think there's an aptitude and an appetite for more of that. So I'm excited to go in there and see the show.
Great. Well, I think it's going to be a great show as well. Thank you, Laura, for your insights. It's great to talk to you.
Yeah. Thanks, Mike.